Removing the cloudy lens or cataract aims to restore crisp, clear vision, allowing you to function better in your normal activities. Cataract surgery will reduce your spectacle dependence, but will not eliminate the need for glasses altogether. For example, with the most commonly desired focus target, most patients will not need glasses for driving or watching the TV. However, they will still need glasses for reading. There are various different lens implant and focus target options, and your eye surgeon will discuss these with you. Whilst cataract surgery has the potential to restore excellent vision, perfect vision is not a realistic expectation, since nothing is as good as youthful, healthy eyes. Cataract surgery will not correct other causes of decreased vision, such as macular degeneration, diabetes, floaters, or glaucoma. Cataract surgery is a very safe and effective operation. For most individuals, the chance of success with surgery is more than 95%. However, like all surgical procedures, cataract surgery is not absolutely safe. The chances for serious complications are generally less than 1%, which may cause impaired vision and/or eye discomfort. Potential complications of cataract surgery include infection, about 1 in 1,000 chance, bleeding, severe eye inflammation, swelling in the macula, retinal detachment, interference with retinal blood circulation, glaucoma, clouding of the cornea, retained pieces of lens in the eye, need for a second operation, double vision, and droopy eyelid. Even when such complications do rarely arise, they can often be treated successfully with medical or surgical treatment. However, very rarely, they have the potential to cause permanent loss of vision or loss of the eye, despite best efforts. The selection of the proper lens implant, whilst based upon sophisticated equipment and computer formulas, is not a perfect science. Every eye is slightly different, and after your eye heals, you may be slightly more short-sighted or more long-sighted than was intended. Rarely, additional lens surgery or laser vision correction may be needed if you are not satisfied with your vision after cataract operation. The purpose of this video is not to frighten you. Rather, it is to ensure that the decision to undergo cataract surgery has been carefully thought out with regard to the benefits and risks. Fortunately, for most individuals, the chances of success with surgery is more than 95%. To put things into perspective, cataract surgery is considered to be one of the safest surgical procedures performed today. This video has been designed to be a supplemental educational material, and further tailored discussion will take place with your eye surgeon. Please ask any questions that you may have to ensure that you have a clear understanding in order to make an informed decision to proceed with cataract surgery.